Good evening. I'm Pittsburgh City Councilman Daniel Lavelle,
And I'm Councilman Reverend Ricky Burgess.
and we welcome you to Black Pittsburgh Matters. Black Pittsburgh Matters is a series of virtual town hall meetings affirming a citywide agenda that Black Pittsburgh does indeed matter. Black Pittsburgh Matters means that Black lives matter. We must protect the health and safety of Black people. It means that Black communities matter. We must focus on rebuilding Black communities. And it means that Black wealth matters. We must focus on increasing Black employment and entrepreneurship.
The Black community has been disproportionately affected by concurrent crises, the COVID-19 pandemic and the economic crisis, and race relations, which are both public health crises. Normally, in time of crisis and great change, we'd be coming to you as the Black elected officials of Pittsburgh and having meetings across the city with our constituents, partners, and allies. Since we cannot do so safely in the current pandemic, we're now using this media and platform to come to you in the ways in which we can, to talk about what we're doing and discuss policy and legislation concerning Black Pittsburgh. These meetings will be available via Facebook, YouTube, and the city's cable channel. You can contact or ask questions via the Black Pittsburgh Matters Facebook page or email us at blackpghmatters, that's blackpghmatters@gmail.com. And of course, you can comment through our live feed right now. Today's town hall meeting is Evictions and Housing Insecurity.
This past Tuesday, City Council passed legislation establishing evictions protections for people facing hardship due to the COVID-19 pandemic. Many of us are facing multiple hardships, a global pandemic, a snowy winter, and a recession, which together has elevated the issue of housing insecurity.
We believe in a public health approach and wraparound social services to address housing insecurity and evictions and work to prevent these evictions. Thus, we invited experts today who work diligently on these issues regionally to talk about what they do, what more can be done, and what resources are available to our residents, as well as answers questions on the subject. But before we bring the guests in, Dan, you and I have both worked hard in our districts of bringing more affordable housing online. I think on the front end, I think people sometimes don't realize if you're working a minimum wage job or even in a hospital job that pays poorly, it's almost impossible for you to save enough money to get housing unless they're subsidized.
Yeah, and one of the other challenges that I've recently sort of learned about is the fact that once people are out of their currently affordable housing, even the housing that they're struggling to afford, once they leave that house, it's very hard for them to go find another place to live that is as affordable or less, because the cost of housing is only going up. Thus, you end up with so many families in this just horrible cycle of always chasing the next apartment or the next place to live, which obviously has mental health effects. It affects children having to go to multiple schools and just has a sort of negative overall impact on quality of life.
Yeah, and unfortunately, what we've seen in the Black community is many of those families wind up in the suburbs. They wind up in Clarendon or McKeesport or Rankin or Braddock or communities, Mon Valley communities. They wind up actually in communities outside of the city. So if you look at the numbers over the last few years, the actual Black community, the percentage of Black people in the city proper is shrinking because you have an exodus of poor Black people because they can't find affordable housing.
Yeah, I believe the statistic is we're now down to about 23.5% of the city's population.
I think we were like 26 or 27% at one point.
Yep.
Well, today we are honored to be joined by Dan Palka and Marcus Gainey Cherry, the Administrative Director and Criminal Justice Liaison for the Allegheny Health Network's Program for Homelessness and Urban Policy Medicine. Our good friend Laura Dragowski, we'll welcome her back from the city's Office of Community Health and Safety. Robert Dingwood, Staff Attorney for Regional Housing Legal Services, and all around great person and scholar with the Mayor's Office, Lindsay Powell, Assistant Chief of Staff to Mayor William Beduto. Welcome all to this evening's town hall meeting.
Thank you all for being here. maybe I'll start with Mrs. Powell, only because we did mention at the beginning that this past Tuesday we did pass a legislation with a moratorium. And you did a lot of work on that, as did Mr. Damewood. And so maybe if you could just walk us through what that legislation does and what it doesn't do.
Well, thank you so much, everyone, for the opportunity to speak on these critical issues. As both council people spoke, evictions are on the rise here, and especially during the pandemic and winter, the city of Pittsburgh and the mayor's office has been very invested in making sure that we have solutions at the city level and working with our partners in the courts level, as well as organizers and activists, to make sure that we are protecting our most vulnerable tenants. Bob Daywood and Councilwoman Gross have been critical in writing the legislation that passed on Tuesday to create an eviction moratorium that puts the burden of proof on landlords in the kind of normal, if you could say that, the normal process for tenants. The burden of proof lies on them. And if we're talking about making sure that people are safe during a pandemic, if we are asking tenants to go through a system that may expose them to congregate settings, where if that person has to go to court or has to be removed temporarily out of their house, or has to move in with a relative, neighbor, a friend, to find housing so that they're not unsheltered on the street. When we're thinking about public health, these are all points where that person could be vulnerable or come in contact with COVID. Whereas if people remain in their homes, if they're able to stay there while a possible eviction proceeding would happen, that then there would be less exposure to COVID. And so, the legislation that passed, again, puts the burden of proof on landlords, that there are exemptions for an eviction ban that would allow a landlord to move forward with an eviction. And Bob, of course, can speak to some of the thinking around there, but the legislation also allows for a department within the city to be the arbiter for, to determine if an eviction is appropriate in that instance. So the Commission on Human Relations will be the department within the city that will help landlords and tenants mediate their disputes. But again, I think what is the biggest takeaway from this legislation is that it aims to ensure that tenants are able to stay in their homes and sheltered while any possible conversations around evictions happen, and that landlords will be the ones to have to go to the Commission on Human Relations to determine if an eviction is eligible or appropriate at that point.
Bob, you want to talk a little bit more about that? You're, I think, the councilwoman said that you were the author of the bill. So if you would talk a little bit about why this is so important and your perspective on it, that would be helpful.
Well, sure. Well, thank you, Reverend. And I agree with everything that Chief Powell just said. I have to be clear, I was not the author of the bill. I helped draft amendments to a bill that was introduced by council a week ago Tuesday. I can't claim authorship of the entire bill, but I did help write some amendments. What the moratorium would do, it would prohibit all evictions except those for non-payment of rent that aren't related to COVID hardship, except for imminent threats to the health and safety of persons, and except for serious lease violations like damage to the property or criminal activity on the premises. As Chief Powell said, landlords can apply directly to the Pittsburgh Commission on Human Relations for an exemption. That process is not yet in place, and there are several of us working around the clock to try to get that in place. It's important to keep in mind it's directed, the moratorium is directed at landlord conduct, so it's not directed at the courts. The city isn't telling the courts what they have to consider, what they can't consider. The city is essentially telling landlords within the city, you will be fined if you evict tenants for a prohibited reason. And so landlord conduct, would include things like, giving a notice to quit, filing an eviction action, or requesting an order for possession, for cases that have already been in the process. And obviously, it would cover self-help evictions, which are illegal already. So landlords who engage in any of that conduct without first getting an exemption from the Human Relations Commission could be subject to a fine of up to $10,000.
Thank you. Dan and Marcus, now we heard about the bill that we've passed, but I want to look at the other side. One of the things that I'm saddened by in my council district, I think there are a whole lot more people homeless than people imagine, because if you don't have a permanent address, even though you may be sleeping on someone's couch, right? You may be in a family member's couch for the day, for the week or for a few months, you really don't have a permanent address. So talk to me, Dan, and Marcus, talk to me about your work in homeless prevention and housing insecurity, but really tell us about how big of a problem is this in Pittsburgh?
Yeah, so this is something that you're alluding to right now is called hidden homelessness, right? And this is something that we've learned over the last now 2 years now, where we've sort of tried to focus on individuals who may not qualify for HUD funded housing programming, which, there are sort of rigid definitions that HUD maintains to, really assess eligibility for some of these programs. But there are individuals who fall into a kind of a gray area, right? And I think a lot of people probably know individuals who are in these situations. There are people who are not street homeless or chronically homeless, or sometimes they call them rough sleepers, people who are staying outside every single night of the year, but they do have housing instability. So that might look like, as you alluded to, someone sleeping on a couch of a friend one night, and then sleeping in a doorway the next night. And maybe they're staying in their car, but every once in a while, a family member will let them in to shower or to sleep on the couch as well. So those are individuals for whom there isn't really designated programming designed for them to pull them out of these situations. A lot of it is waiting for them to become street homeless proper, so to speak. And so what happens during that time is that we're basically watching really precarious situations with individuals until they fall into a state where they then become eligible for this federally funded programming. And so the goal of, I think, our program and really all of the street outreach programs and the homeless services in general is to try to figure out creative ways to wrap around and support individuals who, again, may not be homeless in the HUD definition sense, but certainly are on track to be on the street. And so this is something that a lot of people have talked about, upstream intervention. This is an opportunity for us to engage with individuals before they hit the street and before they get into a situation which we know from our work with people who are experiencing street homelessness. It's an opportunity to prevent a situation that is very difficult to remediate. Once you're on the street, you are extremely vulnerable. Substance use, mental health issues, pre-existing health conditions, they're all exacerbated by living outside, as you well know. So this is an opportunity with the work that we're doing to engage individuals who may be in process of eviction or maybe just housing unstable, to try to prevent them from falling onto the street and instead wrap around them and provide them with services so that they can maintain their housing.
Yeah, and to add on to that, I think a part of that is understanding the process and understanding where individuals are situated within that process, and then giving them the appropriate help and appropriate resources. Some of the work that we've been doing is speaking or trying to connect with tenants who have already had a hearing but don't understand their subsequent rights to appeal, and so directing them to the proper resource and the proper channel. And then also for a little bit further downstream, to work with tenants who are at the almost set out point to where they're being evicted and the constable is knocking on their door to remove them and their things out of the house, to work with them to wrap around right before they are subjected to this transient nature of being housing insecure. And so connecting them with potential rapid rehousing sources, resources, or connecting them with other housing means or individuals we know that can provide the resources to them. So it's working on every part of this stream and meeting the tenants where they are and providing what they may need.
Marcus, you mentioned tenants' rights and them tenants not always understanding their right to appeal or the rights that they have. Can you, or even yourself, Bob, walk us through what rights do tenants have?
I mean, at the very, and I can lean the Bible with this. I think at the very outset, they have a right to plead their case at the magisterial district level, and then they also have a right to appeal the decision.
In Pennsylvania, if you're not living in subsidized housing, tenants have very little rights. Sorry to say it, it's a tenancy at will state. While a lease is in effect, tenants can only be evicted for violations of the lease, right? When a lease is up, and if you're on a month-to-month lease, you can be evicted for any reason or no reason at all. Just no illegal reason. No, like for instance, no discriminatory reason. The rights that tenants have in eviction are basically procedural. So tenants can't be evicted without a court hearing. So landlords have to take you to the magistrate. And tenants have a right to appeal from an adverse magisterial decision. If they appeal, they have to pay money into the court, something called a supersedious bond to stay the eviction, stop the eviction pending appeal. And at this time in particular, there's a lot of tenants who are struggling to pay their rent, and that means paying the supersedious bond is a struggle. And so, the ability to appeal and stop an eviction on appeal during COVID, during these economic times in particular, is stressed. It's tenants are struggling more now. I mean, and Councilman Lavelle, you know this very well because you helped get the city's housing needs assessment and housing task force, affordable housing task force established. There were already 23,000 tenant households in Pittsburgh as of a few years ago paid more than half of their income towards rent. And that's just unsustainable, and it's worse now. I'm sure it's worse now during COVID. I haven't seen any figures on it. It has to be worse now. And so, inability to pay, it affects housing insecurity, but it also affects tenants' ability, the ability of tenants to remain housed through the eviction process.
What about leading up before the eviction process in terms of tenants' rights to stay in their units prior to a notice of eviction?
Well, I mean, lockouts are illegal, if that's what you mean. So tenants can only be evicted through court process in Pennsylvania.
Okay.
To add on to that, there is a notice requirement, but sometimes that notice requirement can be waived through writing within the lease. So,
when we talk about homelessness, when we talk about actually housing insecurity, we know that African Americans are disproportionately subject to the lack of housing in our city. We know that. And the other thing I think we know, and one of the things I think Councilman Lavelle and I have advocated together collectively in our work as part of Black Pittsburgh Matters, is we now need to have a more comprehensive approach to how we deal with the issues that are facing Black Pittsburgh. We know that we need more affordable housing, but that's not enough. we need better schools. And then that's not enough. We need more Black entrepreneurs and employment. And then that's not enough. And we need a better police force. And then that's not enough. We need more social services and more, drug rehabilitation and more programs for ex-offenders. And so, Laura, I want to bring you in to talk about that. One of the reasons I think the Office of Community Health and Safety is so important, now we have a place to put that wraparound services concept. And I think that's your work, is to liaison all these interventions. And I'm the way I say it is everybody's right. Everybody who says what you need for Black communities is right. What they're wrong about is that one intervention won't do it. You need all of them at the same time and at scale. You can't build 5 houses or 10 houses. You have to build 50 to 100 houses with all the programmings all wrapped around. So, Laura, talk about this whole idea from homeless and fear and open disclosure. We had a couple camping out at the church, sitting sleepy outside in the church's vestibule. And Laura was helpful to get them to relocate them. So she's really good at what she does. Laura, talk about the need for this sort of wraparound services concept for people who are at risk and at need in Pittsburgh's Black communities.
Reverend Burgess, thank you. And we actually have one of our partners who directly supported that family you mentioned. That was Dan, and one of his colleagues who's working in Homewood, maybe working right now, actually. I know he's always at it. I think there was, there's something that you said about the disproportionate impact on Black community members. And I was looking at an article that's from like Eviction Lab, and Bob, you may have some more insights into this, but this is a study that was done over a number of counties, not our own. But I think there was some compelling information that we see over and over again in all of the desperately poor outcomes for our Black neighbors. So Black individuals in this particular study made up 19.9% of all adult renters in the counties for which they had data, but 32.7% of all eviction filings. 1 in every 5 adult renters in the sample was Black, yet 1 in every 3 eviction filings were served to a Black renter. By contrast, white people made up over half the population of adult renters, but received only 42% of the eviction filings. Bob, you may be able to say how this is playing out across Allegheny County and across the city. I'm going to guess it's not tremendously different. And it goes back to this disparity that we see over and over again. You were asking earlier about the work that Dan and Marcus and their colleagues are doing, and many other people are working very hard. We're even seeing provision of services in some neighborhoods because they're perceived as safe or the experience is very visible. And when it's not, there has to be a case created. So part of what we're saying here is in some neighborhoods, there's social services. In some neighborhoods, it's police. And that means that someone's calling the police. That means that the police are showing up because they're being called. What does it look like to say the police aren't the appropriate people to be here, but we don't have that social service infrastructure? So some of that is stuff that the city can take on, right? That's our partnership with Allegheny Health Network. That's our partnership around diversion. Some of it we're going to need to push back, and it's what we're kind of trying to describe as a continuum of services. So, Dan and Marcus were speaking about upstream, right? How do we get to a place where we're not even letting people get to that crisis point, letting people get to that harm point? I mean, Marcus and Dan would be better equipped to talk about this than I would, but probably one of the most devastating things a person could see is a person literally being told you can't go back into your apartment. You have no place to put your stuff. You're now homeless with a child, which means your child's probably going to CYF if you have nowhere to go. And you've now lost everything you own, all of your worldly belongings. How do we avoid that? How do we never have that happen to another person again? And that's that early intervention. It's early detection. It's early intervention. It's a great work that's being done, whether it's by the CREATE Lab and the partners in the eviction consortium that are addressing this, whether that's by neighbors starting to recognize and be empowered to understand the issues that their neighbors may be dealing with and knowing the resources that are available. We know neighbors are oftentimes the very best people. People who live in communities are the very best people to understand and be aware of what's going on. It doesn't need to be a social service provider. It doesn't need to be a law enforcement professional. It doesn't need to be a legal professional. It's your neighbor who knows something's up. How do we empower community members? And then if we do get to that point, as Marcus and Bob were saying, if we do get to that point of eviction, how do people like Dan's team show up and say, okay, we are going to try everything we can to mitigate any harm, so you're not sleeping on the street for a year and incurring all of the additional harm that could befall any one of us if we were put in that awful position. I mean, we were speaking to a group earlier, and the mark of a community's, goodness and care for their neighbors is the least, how the people who have the least among us live. And I don't know. I mean, it doesn't look good for any of our communities across probably the country as we look at these significant disparities. So the function of the office is going to be doing really rapid assessment of where our most critical points of intervention are. So our AHN partners are one of the very first. They went out and, if it makes sense, can tell you about how they found a very large number of people who had never been service connected that were living in your district, Reverend Burgess. And it was because we didn't have the supports and the infrastructure in there, despite all of the advocacy you do, despite all of the work our neighbors do, there just hadn't been those investments. And other partnerships look like, let's not wait till people are homeless. Let's not wait till they're precarious. It's the investments in Main Street. It's the investments, as you said, in affordable housing. And I love that statement, which is, if someone says we need something to improve the quality of life for our communities, and especially our Black communities, the answer is always yes. We need all of it. Like, we should just be investing as much as possible in thriving communities. And we also want to see stabilization. So when something doesn't go well, when our communities are in crisis, how do we prevent that recurrent trauma? How do we make it so that that person never, ever has to go through that experience again? Because it's something we wouldn't want for anybody in the first place.
So it's interesting, when I have this conversation with people, and I say the statement you've heard me say on council, that there are no poor white communities in Pittsburgh. There are poor white people, but there are no poor white communities. All the poor communities are Black. And then they say, well, no, that's not true. And they'll almost inevitably, they'll say, well, how about Carrick? I'm like, no, Carrick's a middle-class neighborhood. You can't compare Carrick, whose income is probably in the $30,000 rate, to someplace like Homewood, where it's at the 18,000 household income rate. Dan and Marcus, I guess I need you to help explain to us how bad. Like, we can use Homewood, or I know you're doing work in Homewood right now, so just use that example. You can use other parts of the city. How bad is this issue in a place like Homewood, where there's it's a disproportionately poor Black community, and there are other ones mirrored like that throughout the city? Tell me, how bad is this problem in Homewood?
Yeah, so Laura alluded to some work that we had done last year just to try to get a better sense concretely of, and not completely, I should add, of some of the unmet needs that are in Homewood. One of the things that we do every year is a HUD mandated count of individuals who are experiencing unsheltered homelessness. And it's broken down by community. So, typically, and it's not all of the communities that are in Allegheny County that are counted, but it's really contingent on the capacity of providers and volunteers to go out and actually enumerate individuals on a single night, typically at the end of January, just to get a snapshot of what homelessness might look like across the country. And so we do that in Allegheny County as a continuum. And last year, we made a concerted effort to really sort of make a deep engagement with individuals that are in Homewood. I think years prior, there were maybe one or two people who were counted as a part of the point in time. And, that I think is owing to the fact that homelessness looks very different in Homewood than, say, it does in the South Side, right? In the South Side, you have open encampments. People are staying outside. It's very public. In Homewood, you look at all of the housing stock that's out there. People are staying in abandoned buildings. People are staying in situations where they're housing insecure. They're precariously housed. They're sleeping in cars. You're not going to find an encampment with tents in Homewood. But that doesn't mean that people aren't experiencing homelessness there. So what we did was we just went out and we worked with community members to basically try to identify individuals who maybe at first glance would say, oh no, I'm not homeless. And we'd say, okay. And rather than just taking that at face value, we'd ask, what does your housing situation look like? Or what does your living situation look like? And often they would indicate a building and say, this is my home. But that building didn't have windows. It didn't have any utilities. And so from a HUD standpoint, and we're referencing this a lot, that is a place that's not meant for human habitation, right? And this is a place that certainly does qualify an individual for a lot of those resources that maybe initially they wouldn't have even known about. And we do know that many of the individuals in Homewood don't know about the resources and services that they are eligible for. Most of the conversations we've had with people out there have been not talking about whether or not they're eligible, but merely educating them about the array of services that are available to individuals who are in these situations. They just aren't aware of them. And there hasn't really been a lot of focused engagement with folks out there to help them understand what is available to them. I mean, the statistics, we identified nearly 50 people in Homewood last year, and the prior year's count for the entire county, which is 1.2 million people, for unsheltered homelessness was 48. So already just in Homewood alone, that number eclipses what had previously been counted for the entire county. And we are, very pragmatic about that. And we know that that is certainly not a complete count by any means. Those are just the individuals we happen to encounter on a single day in Homewood. So, when you look at it and you look at the statistics, and this is for the county, but 13% of the population of Allegheny County is Black. But when it comes to the unsheltered population, it's 58% of the individuals experiencing homelessness. And when you look in the shelter system, it's 56% of individuals who are in shelter are Black. So there's a real, a disproportionate breakdown and representation of people who are Black that are in the homeless system and people who are experiencing homelessness.
So I have two follow-up questions. One, you mentioned services that are provided. What services are there out there for individuals or families experiencing home insecurities? And then my second question, and maybe you want to tackle this, Marcus, is part of my understanding of what you all are doing is also trying to ensure that those either homeless and or facing the housing insecurity have access to healthcare. And so if you could also talk a little bit about how that works.
Yeah, absolutely. So the resources are really myriad, although they're limited, again, back to that HUD definition. That's a real sort of a gatekeeper or a barrier for individuals who are in that precarious space. And so, intermittent homelessness is a term, people for whom there are not long extended periods of homelessness means that their eligibility for housing programs that are federally subsidized is just not going to be what it would be for an individual who's always on the street. But when you look at the social determinants of health, when you look at these upstream factors that will ultimately contribute to homelessness, we can still meet people where they are while they're in some form of precarious housing and make sure that they have food security, right? We can make sure that they understand the options in terms of rental assistance. Those are things that are provided, at the county level, and it requires first an awareness of the resources just to be able to start navigating that with an outreach worker. From a health perspective, the really important thing here is having a relationship with a healthcare provider is paramount, for myriad reasons. A perfect example would be when you look at some of these vaccination efforts that are being stood up in some of these communities. You'll look at, some of the barriers that I don't think people recognize really are barriers. We see 65 and older, and, that is something that renders you eligible for a vaccine. But, you also look at, some of the comorbidities that would render you eligible for a vaccine. And then there's a little caveat, which is that you need to have that comorbidity, whatever it is, a qualifying health condition, document. And at first glance, that makes perfect sense. But when you look at these communities and you recognize that an overwhelming number of individuals in them do not have meaningful relationships with healthcare providers, you start to ask yourself, where will they get this documentation? How will they actually produce the documentation to get the vaccine? And so it's little things like that, these inequities that sort of perpetuate, the disparities in healthcare. And so what we really want to focus on is building primary healthcare relationships, and that looks like linking people to community resources. So we have a lot of FQHCs that are excellent in Allegheny County and in the city of Pittsburgh, in Homewood in particular, just because we're talking about it. We have Alma Illery, which is a tremendous community resource. We also have East Liberty Family Health Center, which is a tremendous resource. We want to try to create durable and substantive relationships with primary healthcare providers so that people have equitable care, and that they have more than just an ED visit or go to a Med Express or something like that, but a true relationship within which conversations about health, health education can actually take place.
I think to add on to that, in addition to like a true relationship, making sure that it's a true positive and trustful relationship, being the face that someone can come to and say, I need X, Y, and Z medical assistance or medical help, and I trust you to provide me with that, and I trust you not to lead me astray. And I think that is some of the primary work and some of that bridge building that is being done in the areas that we're working in, and also looking at the health system itself and looking at how it is equipped to actually deal with the individuals we will be pointing towards it, right? And so some of the work of our health systems liaison, she coordinates systems to make sure that if a client that comes to us or that we were referring for a foot injury isn't treated for a wrist injury, right? Because there's a mix-up of documents or whatever it may be. So making sure that, as I said first, that there is a trustful and positive relationship that our community can rely on, and then also making sure that when we point individuals to that system is built and constructed in a way that will positively affect the individual, so that they're not reciprocated through the system again and again.
Bob, I want to chat with you. You and I have done work in the past. I'm a fan of yours. I believe something, and this is the affordable housing conversation and tenant rights conversation. There are some people, I for many years was the chair of the Housing Authority, and we helped to create their process of renewing and rebuilding their developments and moving them from concentrated poverty to mixed income communities, right? I do understand that we really do need more housing for those people who are at the lowest end of the spectrum. But at the same time, and I disagree with those who say we just need to build affordable housing alone without mixing it, because I find that the outcomes of those families are lower than the families that are in mixed income communities. And so I'm curious, we've not talked about this, I'm putting you on the spot, but I kind of think that you got to do both. I think we do have to build more affordable housing, but I think you don't want to rebuild slums and ghettos, right? You don't want to concentrate poor people in certain neighborhoods, but really what you want to do is you want to spread them out into affluent neighborhoods too. But then when you rebuild them in poor communities, you want to also bring in market rate and working class housing so that it's not just concentrated poverty. At least that's what we've learned. That's the best outcome for kids. What do you think, Bob?
Well, I agree with you. Communities should serve everybody, and you need well-balanced communities. I guess my frustration has been that Pittsburgh has been very good at deconcentrating poverty, right? At tearing down low-income housing and replacing it with mixed-income housing. We haven't been so good at deconcentrating wealth, right? We haven't. You can't do one without the other, right? So far, low-income families have borne the brunt of building mixed-income communities. We have uprooted and displaced low-income households over and over and over again in the name of building mixed-income communities. We don't see that much effort on the other side of the coin, right? On ensuring that when luxury housing gets built, when market rate housing gets built, that it is built for everybody, right? That there is a place in all housing development for all Pittsburghers. And so my hope is that we would get better at doing that. and do you mind if I say something really, so
Sure.
there was some, there's been a lot of conversation tonight about the disparities in evictions. And I just wanted to point out, Create Lab has done some incredible mapping. They have mapped out where evictions occur over a 5-year period. And if you lay that map over like a racial demographic map, where do Black folks live, there's a very close correlation, right? Same thing with single parent families. So you can get census data that shows where single parent families live. Very close correlation. And so, unfortunately, you don't see on eviction complaints or eviction, you can't look up eviction records and find demographic data, but it's pretty clear that who gets evicted is Black, single mothers with children. That's who's getting evicted. And you can see that you can see that through mapping, and there have been studies done in other cities that have really documented that close connection. And so I just wanted to, since the issue of disparities came up, I just wanted to kind of make sure that we understand who it is who's getting evicted in this city.
If I may add, I think also when you're looking at evictions and that disparity, we were talking earlier about the cycle of housing insecurity, right? And I think that is something that leads directly into that cycle, because there is an occurrence for, if you're evicted once and applying for a new home, that eviction is going to go against you. So you have a revolving door of evictions and families experiencing evictions, and then also not being able to secure housing for the future. So that disparity directly leads into this housing insecurity question that we're all asking as well.
So this question, it can be answered by anyone. One of the concerns I've had as we're talking about evictions is we're absolutely doing the right thing by protecting everyone during this pandemic. However, at some point, the city's going to open back up. At some point, we will lift our emergency declaration. And at some point, everyone who has not been evicted, many landlords are going to be running to the courts to evict them for whatever reason that is. How do we prepare for the inevitable? And what do you see that doing to our system, right? And to the hundreds of families that are going to be impacted? How do we prepare for what we know is coming?
I think one way we prepare is we stray away from this adversarial system of landlords versus tenants, and realize that it's not the means to try and keep a bad tenant in a house, or to, if anything, it's to make both the tenant and the landlord whole. And there are going to be resources that are going to be provided so that the landlord can receive what they are due, right? And so they can remedy the wrong that they feel has gone against them. So hopefully, again, like I said, to get rid of that adversarial relationship, and then also repair the relationship between landlords and tenant, and open more channels of communications. I know in speaking with some of the magistrates about this issue, it was said that a lot of things could have and should have been taken care of before it got to them. And it's a shame that they have to now deal with this and then add the eviction onto that person's record. So hopefully opening up those lines of communication so that disputes can be addressed beforehand. So repairing that relationship and then making the landlord whole, I think, is one way to start.
Can I add to that?
Yes.
Sure.
All right, thank you. Allegheny County has $80 million in rent and utility assistance money that is going to be rolled out within the next 2 weeks. They're projecting a March 15th rollout date when their application will be live. That $80 million includes $8.9 million from the city of Pittsburgh. The council entered into a cooperation agreement with the county to share those resources. So, I mean, I don't think that's just astronomical. I mean, that is a lot of money for rental assistance. I don't think any city or county agency has ever had that much money for rental assistance. So I mean, the resources are there, and we just have to make sure that we can pair landlords and tenants up with those resources when they roll out.
I must, Bob, I said this in council, I have to repeat this. I do find this a little ironic, right? That landlords who won't take vouchers, who discriminate by source of income, they won't take vouchers, which really is a way of discrimination because they don't want necessarily African Americans in their rent, in their developments. They won't take government money in terms of subsidies, in terms of vouchers, but they're going to run to take this renter assistance money on the back end. So they won't take it on the front end, but they'll take the same dollars on the back end. I have to say that. But Lindsay, and I really want to bring the two of you in, Lindsay and Laura. I talk about the administration's kind of push to really deal with a wraparound support services to Black people. Let's be honest tonight. And I've said this before: if you're poor in Pittsburgh, that's bad. But if you're Black and poor in Pittsburgh, that's worse. If you're, a gay, lesbian, trans in Pittsburgh, you may have discrimination and problems. But if you're Black, gay, lesbian, and trans in Pittsburgh, it's worse, right? And whatever the issue is, when you label Black on top of it, if you're a single mother and a woman in Pittsburgh, that's bad. But if you're a single mother and Black in Pittsburgh, it's worse. And almost really, and Bob, you said this, and I mean, Councilman Lavelle and I were talking about that. I believe that that's part of the problem with our education of our children in the school district system, is that many of these children come from single parent households, and that sometimes people ignore African American women and their issues. And so when we talk about Black Pittsburgh Matters, we really are talking about the gender study. I guess I'm talking too much, but the gender study talks about how this is one of the worst places for Black women in the country. And I want the two of you, in terms of your work, Laura and Lindsay, to talk about your work of trying to empower Black families, but in particular, how to help Black single mothers to be successful in our city.
Absolutely. I want to say first, I think that what's critically important about the thinking that the city, the URA, and some of the other governmental agencies, some of the thinking that they're doing is shifting from thinking about poor neighborhoods to rich neighborhoods, but how do you think about opportunity-rich neighborhoods? Some of the previous conversations that we had on the show about, how do you build affordable housing in poor neighborhoods or what have you, the shift is really thinking holistically about a neighborhood. And to your point, Councilman, if we're not thinking about the educational attainment of a person living in our neighborhood, the ability to walk to a green space and enjoy some fresh air, if we're not thinking about access to food, if we're not thinking about the quality of schools and the education that they may get, and how that varies from zip code to zip code, we're only attacking and addressing a piece of the problem. And so when it comes to building equitable neighborhoods, the idea is, how do you pour into a neighborhood to ensure that they have the resources and support to become opportunity rich, and that a kid from Homewood doesn't have different outcomes because they weren't born in Squirrel Hill, they weren't born in Shadyside, enter neighborhood, enter neighborhood, enter neighborhood. And that shift in thinking really comes from the more collaborative efforts that the city has tried to engage with both the county, both some of our governmental agencies like the URA, the Housing Authority, and the district. One of the specific programs that the administration is incredibly proud of, and I would say, years ago, when you talk about guaranteed basic income, it was something that was, we'll see. Or even think about, the last election cycle when you had presidential candidates talking about the need to give people agency to address their own needs. It was laughed at. And here we are in a space where we've seen, even from our federal government, you could call it kind of baby basic income, where you're giving people a stimulus check that's unrestricted so that people know So people are allowed to purchase and to acquire what they need in that moment. Our governmental programs are incredibly prescriptive. You know, if you're talking about WIC, right? You can buy Kicks, but you can't buy honeycombs. You can buy this brand, but you can't buy that brand. When it comes to our interventions, our poverty interventions at the federal level, it largely dictates and presupposes what people need. If you're giving someone a check, if you're putting money in their hand, if you are putting actual coins in their bank account, that person is able to, you know, make the decisions that they need in order to improve their own individual situation. And I say that to say, you know, the city is engaged in universal basic income pilot, specifically targeting Black women, because we know per our own report that Pittsburgh has some of the worst outcomes for Black women when it comes to educational attainment, occupation attainment, and insert any measure, and Black women inevitably fall behind their counterparts. And so the guaranteed basic income program that we're working on, I think again, allows for that agency. Participants will be getting a $500 monthly check to do just that. You know, in Stockton, California, where this was one of the first cities to really do a full guaranteed basic income pilot. You know, a lot of the pushback they got was, if you give people, you know, money, they're just going to buy booze and cigarettes. And how can we trust people to know what they need when we're not telling them or putting restrictions on these dollars? Consistently, you saw that people were buying new shoes for their kids. They were buying a washer dryer so that they wouldn't have to spend, you know, triple the money at the laundromat down the street. They were buying new school uniforms for their kids. These are the types of things that we know that our government programs can't provide for people. And if we're talking about building a city and building a city that invests in all people, you have to start with Black women, period. You have to start with the women and the people who have been affected the most. And so through the Guaranteed Basic Income Program, and along with some others I'm sure Laura can talk about, we've been trying to specifically call out wrongs and make sure that, again, those who are most vulnerable, those who are most affected, are getting the treatment and intervention and support first.
I think, you know, that's it, right? It's how do we just promote the agency of the people who know what they need? I think there's a massive, so there's something that I've observed, and I'll try to articulate it. I've heard a lot of people bemoaning how difficult it is to get the vaccine, and it is, right? I mean, there's different websites, and you have to, like, people are driving all over the place, and people who don't use the internet are like, I don't know how to do this, and it's inordinately difficult. And something that I think, and you know, Marcus and Dan can speak to that. Marcus happens to be a social worker and MSW as well. Are the indignities that we put people through every day to get their basic needs met. So I've heard, you know, some pretty caustic comments from people like, well, they should just get a job, and, you know, like they should just line up for stuff. And I feel like the other half is now starting to see what it's like to have to line up for stuff and to spend all day trying to get something and to still not get it. And people are furious. And then we say, well, for a large portion of our community, this is every day. We look at transportation. If a person is having to take multiple buses and they have children that they need to get to school, it's cutting out all of this time in their day where they could do any number of things, including self-care, right? Like maintain overall health and well-being. And then we see, you know, pay in jobs that is so low, it precludes people. It goes back to the social determinants of health that Dan was saying. It precludes people from sustaining their housing. It precludes people from having food security. So I think that's, you know, that's a major piece, right? Is that I don't know that anybody can appreciate, and including myself, how deeply difficult it is to navigate all of these systems, which were not built to be navigable. So just go get your check, just go get this thing. It's not that easy. I think the other thing, and, you know, I wanted to just share, is there was between March of 2019 and April of 2019, 1,674 people were booked into the county jail. 50% of them, or 841, were people who are Black. And that's in versus 13% of the county's population. So we're talking about single moms, but then we need to look at who's sitting in the jail and why they're sitting in the jail. And not just why they're sitting, but why they've sat in it before and before and before. And I have a colleague, who has history of marijuana related sales charges. And he now drives past marijuana dispensaries and says, oh, I guess, forget me. I have this charge on my record. I have to deal with all of the discriminatory situations I sit in. And now in, nicer neighborhoods, we're seeing this is legal. So, on a larger standpoint, we need mass expungement. We need a way that we make good or, make better on all of the harm we've done to communities, or we will just continue to see single moms who are going through indignities to make it, and partners who are sitting in jail for things that we have made legal in some communities and not in others. So, I know Lindsay gave a really excellent example of something that is very evidence-based and effective. This is something that seemed really progressive. The diversion seemed progressive a year ago, and we've been working on trying to implement pre-arrest diversion for some time. And now we're looking at it and saying, is this enough? Because basically there are crimes of poverty. If someone is sleeping outside because they literally don't have anywhere to sleep and they happen to sleep on private property, that's defiant criminal trespassing. It's charged. If you've had 3 retail thefts in this county, it's a felony. You're going to the jail. That could mean you stole diapers, you stole formula, and you stole food in 3 separate instances. And that person's going to jail. So what we intend to do, and this is a partnership with our partners at Foundation of Hope in the North Side, our partners at Connect in the county, the health department, the Bureau of Police, is to say no more. And not just, well, we're going to charge you, but then you're going to have to jump through a bunch of hoops. We're going to say, no, what we are doing is criminalizing poverty. We're criminalizing the behaviors that people engage in to survive. And that doesn't make sense, because we've essentially put you in the situation where you're poor, and then we've told you your efforts to survive are criminal. So instead, we're going to say, look, we think rather than putting you in a cell, we need to empower you to tell us what it is that we can support you and help you with. And we've had phenomenal leadership from partners in police to say, we agree. We know that cycling people through the criminal justice system has no impact. Well, it does, but it's not a good one. It's a very negative one. People are their substance use treatment is interrupted when they go to the jail. So you have someone who may have been really stable on Suboxone or methadone in recovery. There was some behavior that attracted the attention of law enforcement. Now, all of a sudden, that person's in the jail. They're detoxing. They don't have Suboxone. They come out. They're highly vulnerable to an overdose or recurrence of use and overdose. They're not better off, right? Things aren't better, and maybe they stole some bread, and now they're susceptible to a fatal overdose. So diversion is a critical program, but it's really a culture shift. It's saying that the engagement of law enforcement in these spaces is just wholly wrong. These are people who are working to figuring out how to survive. And what we really need to do is support people in doing more than surviving, as Chief Powell said. It's how do we get people to a place where they're thriving, where life is optimistic, where we have equity and not just this bare minimum to keep people afloat.
And I just want to put a little bit more light on the statistic you talked about in terms of the jail, that although 50% of those arrested are African American, only 13% of the county. But of the 50% of whites who are arrested, the majority of them only stay at the jail a very short period of time. They go through the intake process and are released. Maybe 75% of them are in the jail anywhere from 12 to 48 hours, and they're never intake to the population. So if you actually go through where African Americans who are arrested, the majority of them go through intake and are placed anywhere from a week to 2 years in the county jail. And so if you go through the county jail's population, it's not going to be 50% Black. It's going to be closer to 75% African American in the general population. And so it's just, we are, unfortunately, we used to joke and say that the county jail was the largest investment in the county for African Americans, because it was built primarily to warehouse African Americans in our county, and we need to do something completely utterly different. And I just wanted to talk about that. If you go into jail, as I have and worked there, how large of a Black population the general population is.
Thank you. With that, I do want to bring on Micah Smith, who's been monitoring the activity taking place online, and see if there's a question or two that the audience would like to have answered.
Hi. The first is, what are rental assistance resources that can prevent people from becoming homeless?
I'm happy to start. So as alluded to earlier, the city and the county both received dollars from the federal government for rental relief programs. I will say, with the first kind of batch of money we got, I think for folks trying to seek help, it was kind of confusing, where if you went through the city, there was one process, the county had another. For folks who weren't exactly sure where to go, there'd be some bouncing back and forth, no guarantee of a warm handoff. So if you started at the city and you weren't eligible because you lived outside the city, it was a little harder to pass you along to county counterparts. With this iteration, we've been working together, and council so wonderfully has signed on to an MOU to allow for us to partner. And this way it'll be more of a seamless and more coordinated effort to make sure that people get rental relief. We've invested in working with community partners in our neighborhoods to ensure that, if you are more comfortable with your CDC or your local organization, that you're able to go there rather than go through some of the more formal entry points that we have. These resource navigators for the city are located in all of our neighborhoods. We've made a very, very conscientious decision to ensure that there's diversity in the neighborhoods that the organizations serve, that we are thinking about possible barriers, whether that be language, whether that be access to transportation. We have drop-in sites, so if you feel more comfortable physically, coming in physically to talk to somebody, you can do that. We also will have online call-ins, phone call-ins. But the easiest way to get through to any of these organizations is 211. 211 has been a wonderful clearinghouse to make sure that you're routed to the proper channels, whether that's a city affiliate, a county affiliate. But working with Action Housing, who's been fantastic in getting all of these neighborhood resources on board. They've been really, really diligent in making sure that this time when we launch this program, and we're hoping to get the money from the feds any day now. We're hoping for the 15th, if not sooner. But we're hoping with this iteration that people will be able to access this money much easier. So that's just a little background for folks so that they know relief is coming and hopefully coming quickly.
Yes, absolutely. I agree 100%. And it's going to be so much easier than last year. There were so many problems with the rental assistance program last year. This year is much more streamlined. Micah, I just emailed you a couple URLs, one for the county emergency rent relief program when it comes online. So the website is up, the application isn't live yet, but the website is up. And so, if you could post that on the Facebook page, that would be wonderful. Same thing with Rent Help PGH. So Rent Help PGH provides support for tenants, both in eviction and in providing for applying for rental assistance. So the rental assistance program that's going to come online very soon in the next, couple weeks, essentially there's an income eligibility requirement, 80% area median income, which is fairly high. That's like probably double the median income of the city of Pittsburgh. You have to have, either lost income or incurred, substantial medical expenses due to COVID. The rent you could get up to 12 months rental assistance, possibly longer if the program gets extended. You can get utility assistance, and unlike last year, you won't have to come up with months and months of like pay stubs to prove that you suffered a loss of income. The documentation will be much more flexible. I don't know exactly what the documentation will look like yet. I think that's still being, what the application will look like. I think that's still being developed, but it will be nothing like the rent relief program from last year.
And I just did want to add another little bit. It's for landlords and tenants. And so, something that has come up consistently in our, public commentary, as the councilmen know, landlords are not sure either where they can get relief. And they've had a tenant who, hasn't been able to pay. They've been in the unit. And for some of these, smaller landlords that have 1, 2, 3, few properties, it's been difficult for them to pay their own bills and such. And so the program will be available to both tenants and landlords.
We should also just mention, because many of us had played a role in its creation, the Housing Opportunity Fund. Even putting the pandemic aside, it's there to also provide assistance for those people looking to potentially stabilize their home, fix up their home so that they don't become home insecure. They have a Housing Opportunity Fund had a program where if you have lost your job and you think you're not going to be able to pay your mortgage or your rent for a while, that they can assist you. And so again, you can go to the URA's website or just Google Housing Opportunity Fund Pittsburgh, and the information will pop up. Quickly, before because we are of the hour, if there's anyone who is watching or may view this, who knows someone who's homeless and may need support and or housing insecure, Dan or Marcus, can you please provide information on how they can get in contact with your program?
Yeah, absolutely. So the program that we are standing up currently is part of the Homelessness and Urban Poverty program at Center for Inclusion Health at AHN. We're working in police zones 1, 2, and 5. So the North Side, Downtown, Uptown, Hill District, East Liberty, Homewood, Highland Park. If you reach out, I don't know if it's possible to put something in the chat, but we have a point person who will be able to direct you to the appropriate services and get you to the right team. So let's see, I can just give you the email address and the phone number of our point person. This is Nicole. She's our health systems liaison that Marcus was alluding to earlier. So her phone number, and this is her work cell, she's happy to receive these referrals, is 412-260-2397. And she will be happy. You can call or text about a particular issue. She will be happy to sort of triage whatever the issue might be and make sure that you get connected to the appropriate resource.
Thank you, and we'll be sure to provide that information on our page as well, so people will have it. With that being said, we have run out of the time that we have for today's show, and we certainly want to thank all our guests, starting with Dan Palka and Marcus Gaines-Cherry, the Administrative Director and Criminal Justice Liaison for the Allegheny Health Network Program for Homeless and Urban Poverty Medicine. I hope I got that right. Laura Dragowski from the City's Office of Community Health and Safety, Robert Dangwood, Staff Attorney for Regional Housing Legal Services, and Ms. Lindsay Powell, Assistant Chief of Staff to Mayor Peduto. In order to have significant investment in the Black community, it is imperative that we make our community safe and peaceful. We are committed to rebuilding Black communities in Pittsburgh for Black people, by Black people, in concert with our various partners and allies. So I thank you all for being here with us.
I also want to thank all of you for watching and participating in this town hall meeting. Remember, you can watch this show on Facebook, the city's YouTube channel, or the city's cable channel. A new meeting will occur every Wednesday. By working together, united in purpose, we can transform our city, strengthen it for all of its residents. Pittsburgh can only be a city for all when it becomes a city where Black Pittsburgh matters. Good evening, stay safe, and be blessed.